Today is April 21st, 2011. We're here today to interview Dr. Ray Hester. Dr. Hester served in the United States Army from 1969 to 1971 and obtained the rank of Major. I'm Commander Brian Allen, a friend of Dr. Hester. Also present are Phil and Esther Lee. This interview is being conducted for the Veterans History Project at the Library of Congress. We are in Brentwood, Tennessee. All right, Dr. Hester, if you would, just kind of tell us where you were born and how you came to join the service.
I was born in North Alabama, Carver County, in a farmhouse there. My dad was a tenant farmer and sometime machinist and carpenter. So we were kind of itinerant people and moved around from place to place. But I was lucky enough to obtain a scholarship to Vanderbilt through the General Motors program, and I went into medicine and graduated from medical school at Vanderbilt, and then went into neurosurgery. Finished my residency training and internship at Vanderbilt, and then went into the Army Medical Corps. As a part of the Army situation at that time, they were drafting doctors, and when a doctor came in drafted, or were told they were going to be drafted if they didn't volunteer, the Army could not draft them by specialties. They just took whoever was there. And so then they assigned the people to whatever place of need they had. And so if you were a neurosurgeon, you might be put as a place delivering babies, if that was what they needed. And that wasn't a good use of manpower. So they developed what was called the Berry Plan, which was a situation in which the doctor could join the Berry Plan and be deferred until he finished his specialty training, and then come into the Army at that time as a neurosurgeon or as whatever his specialty was. And so I joined the Berry Plan, and of course as soon as I finished my residency training in 1969, I went into the Army Medical Corps, and as all of the new doctors did, we went to Fort Sam Houston, Texas, and into the basic medical course there. And it was an introduction to the Army, and it's a funny feeling to go in the Army as a major and not know how to salute. And so we practiced our saluting and knowing who to salute and when, and how to put on our uniforms. And the Army is very specific about you need this design here and this design there and so forth, and it's 1 inch and 2 inches, and so we learned all that. I learned how to march, and they took us down to Fort Bullis, I think it was, and we got to run through the brush and the brambles, and they shot over our heads, and 2 or 3 guys got the heat exhaustion, had to take salt tablets. It was a funny situation for a bunch of doctors who were in no shape at all to go through all that. Anyway, I finished up that part and went then straight to Vietnam. They were in dire need of neurosurgeons in Vietnam at the time. And it turned out that Vietnam was interesting, instructive, and most of all rewarding for me. When we first went in country, you went into a station where everybody went, and they made you brush your teeth with fluoride and all kinds of little things. And of course, the first week you got the flu or whatever virus was going around at the time, and you were there by yourself in the barracks on a little cot, most uncomfortable, running to the bathroom every few minutes, etc. But went on to the 31st Evacuation Hospital in I Corps. In the 3rd Corps, I guess it was. Anyway, it was the main one where the neurosurgeons went, and the chief of neurosurgery there was a colonel and was a full-time Army man, and he watched our operating and so forth, and then selected who to send where in country. And so he sent me to Da Nang by myself, since he thought I could handle it, and fortunately I was able to. But it is a real situation when you're by yourself, and the only neurosurgeon in the 95th Evacuation Hospital. So that means that whenever casualties came in, you went to the emergency room area, and actually it was the incoming area for the helicopters, and you decided who you were going to operate on first and which ones you put over to the side, and you operated until you got through operating, which was either 2 hours later or 36 hours later. Didn't matter. And so you learned right away that there was technicians there, guys who were good at opening and closing and that sort of thing. So they would open and you would be resting, sleeping if possible, and go in and do the operation. And as soon as you got through doing your part, go back and lay down on the cot and rest, and they would close it up and bring the next one in, and so on. And so there'd be spells where you'd operate for 2 or 3 days running, and then you'd have a break for a day or two, and so on. So I got to see many kinds of injuries, fragment wounds, and so forth. I made friends with the Navy neurosurgeon at the Naval Hospital there. They had 2 neurosurgeons there. One was a captain who never did anything, and one was a lieutenant commander who was the same as I was, a major. And so I would cover for him once a week. So he'd have a break, and they'd send the Marines over to my place. And that worked out well for about 3 or 4 months till the captain found out I was operating on his Marines, and that was the end of that. And but I did cover for him when he went on leave, and he covered for me when I went on medevac to Japan one time. We had a lot of different kinds of injuries and that sort of thing. One in particular was a young man who had a fragment wound to the back of his head, had blasted the bones down against the brain and had blocked off the blood flow from the sagittal sinus, which carries almost all the blood flow from the brain back to the body. And he was paralyzed in both legs and one arm, and was still conscious at the time, but was rapidly becoming unconscious. So I operated on him and removed the bones that were pressing on the brain, and the sagittal sinus was torn. The sagittal sinus is the main vein that comes from the brain to the body, and it's not like things elsewhere. It's made out of a fibrous material and has no give to it or anything like that. And so when it's torn, it's very difficult to repair. And since all the blood from the brain goes back through there, you can bleed out in a matter of minutes. So in his situation, I did sort of an experimental procedure in which I made a shunt out of a piece of plastic tube of children's endotracheal tube, and at that time the children's endotracheal tube did not have a cuff that you could blow up. The adult ones did. When they put them down, they blow up so the air wouldn't escape around it. So we had tracheostomies and we used metal tracheostomies at the time, and they had a little cuff that would go on there that was a little balloon that you could blow up, and it would occlude around the area. So I put a cuff on each end of that little plastic tube and put the plastic tube in there and blow those up. And so the blood flowed through the shunt while I was able to repair the sagittal sinus, which was the first time, as far as I know, was ever done. One of my colleagues later wrote it up in the journals. And so the guy survived and actually got all of his strength back and everything. And as was usual at that time, we operated on him and we backed him out to Japan almost immediately, in a day or two anyway. And so that was the last I heard of him until many years later when he showed up in my office in Nashville. And he had been looking for me and for a long time, and he said that, you know, it was strange when he went back to Japan that all the doctors were coming by to look at him and to poke on him, and he couldn't figure out what had happened. They were interested in this new device I had used to do this operation. In any case, he came, and he lived in Knoxville, Tennessee, which is not far from Nashville, about 3 hours, and he mentioned to his doctor there, who he was seeing, that he was would like to find Ray Hester. And he said, well, he's a good buddy of mine, used to be a teacher of mine, and he's at Vanderbilt Hospital in Nashville. So he showed up, as I said, in my office, and we had a fine reunion. And I was glad to see him doing so well after that struggle that he had. There was had lots of other interesting things happen in Vietnam. We had the children's German orphanage that I went to. I went to the downtown hospital there and helped some of the Vietnamese surgeons operate. They did things a little differently than I did, and they operated on people's backs lying on their side, and I never had done that. I'd always had them lying on their abdomen. And so that was an interesting sort of change.
That worked better?
It was better because if you lie on your abdomen, it causes a lot of blood to come up into the wound and that sort of thing. And if you lie on your side, the venous drainage is better. And so it's better that way from that standpoint. And for them, that was a lot better because they didn't have the same control of bleeding and so forth that I had learned. I went down to the local hospital, and their hospital was a little bit different. The families all came in, sat around in the rooms, and fed the patients and brought their food in for them and took care of them. Generally, they didn't have any real nursing care. And that was another thing that we did at the 95th was had a special program for the nurses and the corpsmen in care of the unconscious patient, which was a new thing sort of for them, and how to handle that and so on. So I had a really good experience there, and then after I finished my tour in Vietnam, I came back to Brooke Army Hospital in Fort Sam Houston, and I was assistant chief of neurosurgery there, and had a good experience there, and took care of a lot of good folks, and that was pretty much my tour.
Mm-hmm. At Sam Houston, were there a lot of folks coming from Vietnam, injured and wounded, that you were still dealing with, or was that more of a civilian hospital?
We got some, but most of the returnees didn't come to Fort Sam. They came to the coast in San Francisco and Oakland and the big hospitals there. Okay. And but most of the work that we did was with civilians. well, not civilians, with the military other than ones coming back from Vietnam. We didn't do any civilians, really.
So your total tour, you were in Vietnam for 2 years?
Well, I was in Vietnam for a year, and then for exam for a year, yeah.
Well, go back into your, growing up. You said your dad was a tenant farmer, and so obviously you probably grew up, I'm guessing, a little bit on not the quite poor side. But how did you come to get to this scholarship when you identified as a high school student?
As I said, we moved around a lot, and Dad, we moved to Mobile. When I was in the first grade, and he became a machinist at the shipyards there, and we spent about a year down there, and then we went to Oak Ridge, and we spent some time there, and then we moved all over Alabama, Mississippi, and so forth, and then wound back up in Mobile at my senior year. I had attended Red Bay, which was a small high school. We had 24 in our graduating senior class at Red Bay. And, of course, I played football there, and we didn't have enough football players to dress out 2 whole teams, so we had to play one team, just one side, and everybody would run around one side, or pass around that side, so we always knew which way the ball was coming. But in the middle of my senior year, we moved to Mobile and Pritchard into Flagler High School, and they had 700 and something in their graduating senior class. And so I was a small little country boy, kind of lost in that situation. And come to find out that my studies that I'd had at Red Bay were nowhere near adequate to handle going to college. So I had to I took plain geometry, solid geometry, and algebra, second-year algebra, all at the same time as a special privilege sort of thing. The math teacher said I couldn't do that, but I talked her into it. If I could handle it, she said okay, she would try it. So I took all 3 of those, and I took physics and chemistry, all down there at the same time, and so knowing we didn't have any money, they had a counselor there, thank goodness, and so she had a bunch of tests, and she let me take all these tests to kind of prepare for things, and she had all these scholarship things that apparently were available. And so I applied for the Gorga Scholarship, and I did an experiment in chemistry where I made changed oil into Crisco sort of thing, hydrogenated oil, and so I got to go to the Gorgas Scholarship Foundation, and so they brought us all to Birmingham and took us to this banquet, and they brought this wedge of lettuce out. I had never seen a wedge of lettuce. I didn't know what to do with the wedge of lettuce. I didn't know which fork to use, so I just watched the guy next to me what he was doing, and so it was a really strange situation for me. I mean, to go to a banquet and all that sort of thing. Anyway, I didn't get that scholarship, but they did have competition where you could use what you'd learned, and I had developed a great vocabulary. I couldn't pronounce any of it. And so if you were talking to me, I probably wouldn't recognize the word. But on the paper, I knew what the word meant. And so I did really well on the test because a lot of it was the word meanings and that sort of thing. And so I got a General Motors scholarship. And they were supposed to pay all of the tuition and that sort of thing and so forth. And so I actually got into Vanderbilt, and the competition for entrance into Vanderbilt was pretty high, and so was the tuition. Well, the principal of the school down there we could have gotten up to $2,000 for the tuition and some extra. But he thought that was too much money for any one person to get to go to school, so he only got me the tuition. So I had to work during my time, and my dad sent me $10 a week. He's a carpenter at that time, and $10 a week was enough to get me by. And I would work in the summer. I worked as a carpenter's helper. I knew a whole lot about carpentry from my dad, and I worked at a paper mill in Mobile for a while, and so I got through my undergraduate school there at Vanderbilt, and I got into medical school on my record from Vanderbilt. They were a little bit partial to Vanderbilt students, but so they got me in, and they had at that time a scholarship where it was sort of if you get through and you get to be a doctor, you will pay us back so somebody else can use it, and that way you could deduct it because it was a gift. And so I got through that, and during that time it's a long story about Dr. Meacham, who was the head of neurosurgery, was quite active in the political scene in neurosurgery and so on, and so he was quite a role model, and so I wound up going into practice with him eventually, and but after my tour in the Army, and so as I said, I wouldn't give up my time in the Army at all, and unfortunately in the Army, once you get past major and into lieutenant colonel or colonel, it becomes more of a administrative sort of thing and not a practice sort of thing. And I'm a practice kind of guy. I use my hands and that sort of thing. And so I might have stayed in if I could have continued to do my operating, but that wasn't to be. So I came back and went in practice in Nashville, and have spent all my life here
since then. And what was your undergraduate degree in?
I had a Bachelor of Arts, but I majored in chemistry, and I had in biology, and I had the American Chemical Society certificate and so forth. And as a part of my training and so forth as I was growing up, was learning all these different things and learning how to study and that sort of thing. So when I went into Fort Sam Houston, into the Army Medical Corps basic course, then I was a distinguished undergraduate there, and the fellow who was talking about it said, wanted to know if I had gotten the notes or something somehow. He had never seen anybody who got everything right. And so I said, well, no, I hadn't. I just had my notes.
And that course was what, like 6 weeks long? Is that?
Yeah, that was about it.
And so you finished that course and went straight to Vietnam?
Yes.
Okay. Was that stopover? Did you fly through Guam or anything like that, or do you remember?
Yeah, but I don't remember where we stopped. All I remember is when we came in country and I was looking out the windows of the plane, there was these white puffs of smoke coming over this green countryside, and here I was thinking, little Army doctor, what am I doing here? And we got off the plane and at the main air base there, and we had to run from the plane to the buses because they were shooting at us. And the planes took off. They had a raid on and going on at the time.
Wow.
So it was interesting.
I'll bet. The one story you shared was amazing. Were there any other cases that kind of stood out while you were there? I'm sure you saw a lot of different types of injuries.
Yes. when the head injuries were things that I was familiar with, and they were my bread and butter, and they were things, the only one that was especially different was the one I was telling you about, where this guy would, if I hadn't have done this guy would have never survived the operation. He would have bled out on the table, and I had the visitor, I had the from the hospital in Washington came, and he was a neurosurgeon there, and he came through and was checking on the little neurosurgeons and seeing how they were doing, and that was an interesting thing. He operated with me, and we clipped a special little vessel in the head and that sort of thing, so he thought I was all right. And then had other physicians there, since I was by myself. Some of the other guys, they had a couple of orthopedic surgeons, and a lot of the injuries that came in were multiple fragment wounds. They would have 15, 20, 40 wounds on legs and torso and body, and they weren't, they were just that deep, let's say. But the way to treat those at the time was to take out the fragment, leave it open, put in a drain, and leave them there and send them off the country. But doing 40 or 50 fragments is a long, boring process, so I would often help the guys do that part. And there was another guy that they brought a guy in with a live round in his there, and so Miguel needed some help with that, and so I went in and helped him with that, and they had sandbags all around. It was a real dramatic scene, you know, and so they we got the round out without it exploding. They you know, so they had the officers club there, you know, and they had the little bands that came, and we would. I couldn't celebrate much with the guys because I was on call all the time, but I would go in and listen to the bands, and they had our favorite song was "I Got to Get Out of This Place." It was the last thing I ever do.
I bet that was popular.
Yeah, it was popular.
Did you have any brothers or sisters that were in the service, or?
No, I have a sister that's 8 years younger than I am, and twin brothers that are 14 years younger than I am. So they missed all of the Army and service times.
So you're the oldest?
Okay. Much older than everybody else.
And you talked a little bit about the political, the medical with Dr. Meacham. So when you got into medical school at Vanderbilt, how did you do there? I did very well. I wasn't an undergraduate at there, but I was cum laude and undergraduate, and I was in the top 10% of the class, and that's one reason I got into medical school. And then in medical school, I did okay, and very well, as a matter of fact, and did my internship, and already had spoken with Dr. Meacham and his group, and we had made plans for me to come back after my service times, and so that's what I did. Came back to Nashville. And okay, and that's, I'm guessing it's a pretty long, after an intern and there's residency. How many years before you finally were fully qualified?
Well, I had you have 12 years in high school, you have 4 years in college, you have 4 years in medical school, you have a year of internship, you have 2 years of general surgery residency, you have 4 years of neurosurgery residency, and finally at age 33, I come out and go into the Army and make some money for the first time. That was my thing.
It's a lot of training. But in that field, I guess it's required.
Well, when somebody operates on your brain, you want to know what they're doing.
Exactly. So you worked with Dr. Meacham for several years and then went on your own?
No, he was he was the chief of neurosurgery at Vanderbilt, and he had a special situation, and so his group, which I was a part of, consisted of he and Dr. Cobb and Dr. Capps and myself. And we ran that hospital, the neurosurgery program there, and it was a training program. I had a bunch of residents that went through there and that sort of thing. And I stayed with them, of course, until he retired. And then the group continued after he retired. So Dr. Capps died, and Dr. Cobb retired, and I was the head guy in the group then after that for several years, and we had several other people to join the group, and the group's still going. I'm retired now, but
all at Vanderbilt the whole time.
Well, Vanderbilt Hospital, and then the Vanderbilt had aegis over the VA hospital where they had residents, and the city hospital where we had residents, and the Harry, which was the black hospital at the time, which is part of what we covered. And then, since we were the only neurosurgeons in town, we went to the private hospitals, Baptist, St. Thomas, and so on, and operated there also. So, as I said, it was a special situation since we were the only neurosurgeons in Nashville at the time. Essentially, we did all the work for the private places as well. So Dr. Meacham had a contract with Vanderbilt, and he got paid $1 a year. And he kept whatever monies he made from his private practice.
Okay. That's interesting. All right. Well, thank you. Do you have anything else that you wanted to bring up?
No, I think that covers it about as much.
That's fascinating. Thank you, Dr. Hester.